We're studying the interaction that breast implants have with basically inflammatory tissue.
October is internationally recognized as Breast Cancer Awareness Month. To commemorate the month, we recently met with 2024-25 US Fulbright student Joseph Puthumana. A surgical resident at Johns Hopkins University in Baltimore, Maryland, Joseph decided to take a year off from his surgical residency to pursue a project that's near and dear to his heart. As a US Fulbright student, Joseph is spending the academic year in Innsbruck at the Medical University of Innsbruck, where he's researching breast implants and both the opportunities and challenges they present for individuals recovering from breast cancer. In this interview, Joseph discusses his research project as well as the short and long-term goals of his Fulbright experience.
So my research project is going to be in Innsbruck at the Medical University there. I'm studying with my PI, whose name is Dr. Wolfram Raunecker. We're studying the interaction that breast implants have with basically inflammatory tissue. So in our case, we're doing a pretty self-contained study. It's a new study. We're not joining anything that's already existed. But we are looking at breast implants with various materials and various surfaces, which is sort of the most new aspect of this, and their interaction with various human serum, which means just blood samples, to see what kind of inflammatory reaction you get with these different surfaces. And just, for some background about why this exact project and this exact question is important. A lot of breast implant cases, obviously breast implants are done all over the world and they're done pretty regularly, both for cosmetic reasons, which everyone knows about, and also for reconstructive reasons, which I guess is less talked about. But, of course, many women who have mastectomies after breast cancer, like my mother, they end up getting breast reconstruction with either with their own tissue sometimes, but in a lot of people, they're not good candidates for having these long 12-hour surgeries to have your own tissue to do your breast reconstruction. And so many women just do breast implants. And it's actually a very good option for a lot of people, and a lot of people are very happy with that. But there is a problem generally that in certain numbers of women, which is not an insignificant number, they end up getting this inflammatory reaction called a capsular contracture, which is that the body sort of sees a foreign object or a foreign body, and then it sort of walls it off, sort of the way it does with, like tuberculosis or something like that. And over time, that becomes very fibrotic and hard and painful. And so the patient has to undergo multiple revision surgeries sometimes, have the implants removed or the pocket put in some other place, have the entire capsule excised. So it ends up becoming like a larger deal if that ends up happening. And we don't really have any good, to be honest, we don't totally understand why exactly that happens. I mean, there's hypotheses, but regardless, we know that it happens, and we don't really have a good technique to avoid it preventatively, or the best we can do later on is like what I just mentioned, excision removal, pocket exchange, and all that. In a lot of places, in a lot of hospitals, like my own institution at Hopkins, the breast cancer reconstruction and the plastic surgery aspect are pretty heavily involved, if not in the same building, as oncologic surgery. So when people have breast cancer, we usually have a pipeline, like many hospitals do, where they can meet with a plastic surgeon basically immediately after they meet with their breast surgeon. And they have already had a plan to have, mastectomies, or maybe it's a small part of the breast removed rather than the whole breast removed. But regardless, there's going to be some degree of asymmetry and obviously some degree of discomfort for patients if you have one breast and not the other, or if you go from your whole life having both and having none. So they meet with plastic surgeons basically immediately afterwards. And then we talk to them about what we can do to sort of help them go back to their daily lives afterwards, and to go back without having to feel this sort of stigma about having had breast cancer. Especially nowadays, a lot of people younger and younger are having mastectomies because of the mutations and family history, and they don't want to risk getting breast cancer later on. And so we're talking about people who are in their late 20s or late 30s, who have had mastectomies and aren't prepared to live life like that for a long time. So we sort of come in and we see what we can do. And a large part of that currently is using breast implants to sort of recreate whatever breast that the patient's looking for. My goal for this research, and one of the nice things about having to apply for the Fulbright and the Marshall Plan specifically, is that they ask you pretty specifically about what it is you want to do and why it is you want to do it, and how it is you can do it in 1 year, which is good because it gets you thinking in a pretty deep way about how exactly am I going to structure a study or a research project that can be feasibly accomplished in 1 year, and I can actually get an answer to a question that actually matters, which I think is a good exercise naturally. And I think, a lot of times in science, when I'm just in America and I'm going to be there for 5-10 years, it's sort of an open-ended question. It's just like, oh, I'm interested in this topic. Now, how do I add things onto it to sort of get to that? But there's sort of something good about having a self-contained year and having to outline ahead of time what I'm going to get done in that year and how I'm going to get answers. So my goal here is that, like I mentioned earlier, we have a very narrow question, which is that we want to find out what kind of reaction does human blood, basically the human body, have against certain implant surfaces. And the larger question of that is there a way we can create new, later on, better implant surfaces that have less of this inflammatory reaction, and people have to have less surgery later on, and they can have these implants for much longer, and they're less painful ultimately. But all that the longer down the line questions are, bigger questions. But right now, our only question is, if we do another surface, do we see a change in the inflammatory reaction? And that's the question ultimately we're trying to ask. And I've talked to Dr. Wolfram-Raunecker, and that seems like a pretty doable project. And I think we can get the data collection done in several months, and then we'll do a lot of analysis and write it up. And I feel confident about it. And we've only just begun, so we'll see how it ends up being. But I'm looking forward to that. I think there's stigma interestingly, for both the patients and the surgeons, specifically when you are doing implant-based research. I think it's the kind of thing where I will talk to people at a cocktail party or wherever at all, or even in a professional context, who don't know that much about plastic surgery. And I tell people that I've gotten this amazing Fulbright that I'm very excited about to do this research in Austria. And people will ask what the research is about, and then I tell them we're studying, the inflammatory reaction to breast implants. And then not a negligible number of people will roll their eyes thinking, how did this guy get a Fulbright to study breast implants? So that does happen, definitely. Like I mentioned, I think that it's just sort of a lack of people being aware that, breast cancer is one of the most common things that happen to anybody in America. It's certainly one of the most common cancers that's going to happen to you, and it's sort of life-changing for a lot of people. And this is a procedure, this implant reconstruction is something that a lot of people go through and a lot of people struggle with. And so it's just nice for us to be able to talk about, getting that stigma off the table and advancing this field without it being this sort of big boogeyman. Aesthetic surgery has a lot of connotations for a lot of people and a lot of negative connotations for a lot of people, and triggers sort of a pretty defensive or reactionary response in a lot of people, and I totally understand that. But I think it's good for us to not conflate, what cancer patients have to go through and their ability to get reconstruction with some sort of negative stigma of everything that people wrap up in their heads with aesthetic surgery. We have this research here in my program, which I'm very fortunate to have, where they let you figure out what you want to do for a year at any institution, really. And then if you feel like it's going to help you in your academic arc in some way, they encourage you to go for it. And I found the Fulbright from a friend who had done this a little while ago, the EU fellowship at least. And I thought it would just be a perfect fit. So I applied for it. And the reason that we're doing it here in Innsbruck is because the institution here and the surgeon that I'm going to be working with it's an excellent institution. They do excellent plastic surgery research in all sorts of fields. And creating this sort of collaboration between, I think, Johns Hopkins and the Medical University of Innsbruck helps us because it gives us more of an opportunity to collaborate in Europe. I'm hoping to go to the European plastic surgery meeting this year and just make more friends and figure out what else is going on in the world. Because, obviously we're isolated on the island of America, and we sort of focus on what kind of research people are doing there. So it's nice for us to just be aware of what's going on here, and hopefully that'll create fruitful, maybe cross-institutional collaborations. Innsbruck and Austria are so tied in with the rest of the EU that it's sort of a gateway at this point for us to do more collaborations and larger collaborations with institutions here.